And programs in support of persons living with cerebral palsy disorder. The president of the non-governmental organization for children living with the condition, Secheled, Mrs. Karen Anjira, made the call in Abuja as a forum to create awareness on the disorder. Correspondent Modupe Aduluju has the rest of the story.
Cerebral palsy, popularly called CP, is a neurological disorder caused by a non-progressive brain malfunction or injury that occurs while the child's brain is underdeveloped. A doctor with a private hospital in Abuja, Dr. Chinwe Osuji, said the causes of the disorder includes taking of medications by pregnant women at early stages of pregnancy.
Like steroidal drugs that can cause abnormality in the early development of the brain. It could affect that area. When the baby is born at early stage, the baby will come with it. Another factor is most people that normally, if you tell them to go to the hospital, they refuse during birth. The injury, as in the way the baby is treated during the time of delivery, if the baby falls down accidentally, it can affect the brain too.
The president, Sweet Child Center, Mrs. Kawan Anjira, who also has two children with the conditions, shared her experience.
Sedo, whom this place is named after, was born 2005. She was born with cerebral palsy. Sedo could not walk, Sedo could not speak, Sedo could not talk. I don't think she knew me as a mother. While Sedo was alive, Fa was born. He was born in 2007. He died at about 8 years. And Fa was born with similar conditions.
Mrs. Anjira said children with such conditions don't get the necessary support from government and well-meaning Nigerians.
The advice we get is kill them, drown them. They are not children. They are snake incarnates. They are spirits. We've written to so many of these ministries, but help is not coming. We need support from government. We need support to have a bigger place. There are so many children out there.
A horticulturist who has a child at the center said he has not received any support from his relatives.
Because my son, Miracle, is a child born with special needs. He's suffering from cerebral palsy. My mother and my senior sister, that is a pastor today, both of them asked me, you and your wife, where did you people go and get this kind of thing from? It's not in our family line. So please, you and your wife just know how you contacted this and know how to go about it. So I must confess, since I brought Miracle here, we've been happy. I give glory to God.
According to a middle-aged man, Daniel Yonenge, living with the condition has not been easy.
It has not been easy, but the grace of God has been sufficient for me. Because as a person with sleep, the major problem is that the brain normally passes wrong to other parts of the body. So it's difficult to coordinate
Daniel Yonenge, who called on governments at all levels to support those living with the disorder, urged parents to seek for expert advice and treatment for their children in Abuja. This is Modupe Aduluju.
An assessment report presented to the public by the Federal Ministry of Health indicates that 380,000 children are living with HIV. Out of the estimated figure, only 12% of the children are receiving treatment. At the presentation of the report in Abuja, the Minister of Health, Professor Isaac Adewale, explained that the report would help in the fight against the disease. Correspondent Daniel Adejo has the details.
The report, titled Dissemination of the National Acceleration Plan for Pediatric HIV Treatment and Care, was developed to refocus attention on children living with HIV and AIDS in the country and to seek a new path to reduce the rate of contracting the disease to the barest minimum. The Minister of Health, Professor Isaac Adewale, who expressed concern over the increasing number of children living with HIV, said steps had been taken to address it. Professor Adewale, represented by Director of Public Health in the ministry, Dr. Evelyn Igige, affirmed that the country had the capacity to manage children